Welcome back for our third segment of Fibromyalgia and Chronic Fatigue Update. I am Dr. Richard Podell. Our guest expert on how to exercise when you have fibromyalgia is Dr. Kim Jones of the University of Oregon. She's an associate professor. She's also president of the, the Fibromyalgia Information Foundation. That's right. And we have been talking about specific ways that people with fibromyalgia or chronic fatigue can exercise better. Better means safer, so that you don't feel worse. Better means so that you are getting ahead and getting fitter. Better also means that you are getting satisfaction out of what you're doing. So, Dr. Jones, what is your next recommendation?
My next recommendation is that it is possible to be fit at any size. I have many patients that think that if they're a few pounds overweight, maybe fitness isn't within their grasp and that you have to lose weight and be at ideal body weight before you can be fit. And there's a lot of evidence that says that's really not true. You can improve your aerobic capacity, your strength, your balance, your flexibility, regardless of your weight. So the most important thing is to be comfortable moving. So that may be having comfortable clothing. So, even if you're doing water exercises, if you're not comfortable in a swimsuit, wear something you are comfortable in the water. If you're in a gym, you might choose to be in a class that doesn't have mirrors, for example, or away from the mirrors, for example, if that makes you feel uncomfortable. I would definitely avoid fitness professionals who repeatedly discuss size or dieting in a negative way. If you have a fitness instructor who's talking about, doing the exercises and getting ready for swimsuit season, that's not the reason we exercise in fibromyalgia. We exercise so that our symptoms don't get worse, we can maintain function, we can be independent, and we can feel better. So those kind of fitness professionals are probably not going to be a good fit for people with fibromyalgia and chronic fatigue. Also wanted to mention some gym equipment that I think is more appropriate for people with fibromyalgia. If you want to use a cycle, for example, an upright bicycle may not be as good of a choice for you as a recumbent bicycle. So you might get some back support with a recumbent bike. You might have less activation of trigger points around your hips. And as long as you don't have the pedals adjusted too far away from you, less activation of trigger points around your knees. So a recumbent bike is a good option. An elliptical machine is a good option. Remember that you don't have to use the arms on the elliptical machine if you're just starting out. And then when you do get ready to use the arms, use them at a position that's very close to your body, not very extended high above your shoulders and away from you. Your machine will say, oh, you'll burn more calories if you'll put your arms higher. But we're more interested in having you slowly maintain and regain your fitness, and working that far away from your body may actually make it worse. Another piece of equipment that's fabulous in a gym is a treadmill, but treadmills come in all shapes and sizes. The best treadmills have a really long and wide belt. They even have a difference in the color between the part that's moving and the part that's not moving to minimize your risk of falling. So when looking for a treadmill, see if you can find one with those characteristics. Another modification for people with fibromyalgia is to modify for dizziness, poor balance, and fall risk. This is increasingly being recognized as a big problem in fibromyalgia, and it was really not thought about 8 or 10 years ago. We didn't have any idea that balance and falls were problematic. So what we do in our exercise classes is we have people exercise often holding on to a cane, a Nordic track walking pole, a chair, near the wall, near a ballet bar, something so that even if they don't need it all the time, they could reach out and use it when they do need it. We minimize routines that have turns or pivots. We don't recommend doing those. And this is sometimes a problem that we have with some of the classes that are oriented towards seniors, is that they rely on repetition and pivots. And that's because they're trying to retrain the vestibular system. And if the only problem you have is your vestibular system, that's a good thing to do. But with fibromyalgia, we have problems with pain and fatigue and sleep and autonomic nervous system and lots of other problems. So we don't want to do routines with lots of repetition, no quick turns, and no pivots. Another thing we want to do is slowly challenge the balance system and train for improvement. So an easy way to do this is to let your hand, or your eyes rather, follow your hand as you slowly move. And that will help retrain part of your balance system. We have people train on little balance foam mats. We have people train on TheraBand balls and alternate picking up 1 foot at a time, which helps the core strength, which helps balance. We have people that are very advanced that might even do part of a standing exercise with their eyes closed, because this limits another source of information and optimizes balance. So anything you can do to modify your risk of poor balance and falls is encouraged in fibromyalgia. Anyone who's had a fall knows that it takes months to come back from that, and that often means months away from exercise. So whatever we can do to minimize fall risk is important in fibromyalgia.
One thing that we might add to that list of what to do, a lot of people, this is wintertime, a lot of people have trouble with low vitamin D. And if the doctor can measure the vitamin D level and it's low, there is pretty good evidence, I think, that low vitamin D tends to make for muscle weakness and worse balance. And so that adding the vitamin D back would also be an adjunct.
Yeah, and we do have several studies in fibromyalgia that have shown low levels of vitamin D. We don't have big enough studies yet that show replacing vitamin D reduces falls in fibromyalgia, but it's certainly associated with several other major diseases. And here in Portland, Oregon, we're very far north of that imaginary line between Los Angeles and Atlanta. So all of our patients are on vitamin D supplementation. Another modification for fibromyalgia is to maximize self-efficacy, and we often do this in a group, and we do it in a way that's fun. So what is self-efficacy? That is really self-confidence. It's seeing other people like you be successful. It's being in a class with other people who have similar challenges and watching them progress and realizing, gosh, I can progress too. It's also having a program that's possible to do. We call that mastery. So if I sent you to a class that was just going to be impossible, like some sort of CrossFit training, that's done by 18-year-old male athletes, for example, that would not be a good fit for your self-efficacy, because that's not a program that's really possible for you to do when you have fibromyalgia or chronic fatigue. So getting into a kind of exercise program, group exercise program, that's actually possible increases your self-efficacy. Another thing that increases your self-efficacy is when you start to feel better, when you have less pain, less fatigue, when you start to sleep a little better, have more confidence, and certainly have return of your functional fitness, then that encourages you to continue to exercise. And also just having a caring instructor who tells you they know you can do this and that you're doing great, and they see your progression. It's often when you have a chronic illness, you think in terms of what you can't do anymore. And if you have a really good fitness instructor, they'll point out what you can do now that they've noticed over the last few weeks you haven't been able to do. So being in a group setting like that is often a way to maximize your self-efficacy. It's often fun too. Some people really enjoy the energy they get from being with a group. So if you can possibly find a group, that would be a good way to go. We have a motto in our group, which is start low, go slow, but get there, meaning progressively overload the muscles, progressively overload the cardiovascular system so that you make progress over time. But it's a very slow progression.
When you use the term overload, that makes me wonder. You mean, I guess, increase the load, but not overload.
It's a good point. That's an exercise physiology term that we use in academia. So what I mean is with every couple of weeks in your exercise session, unless you're in a flare, you should be able to make something just a little bit harder, whether it's standing on 1 foot for 1 extra second, or whether it's doing a 5-pound as opposed to a 3-pound weight, or whether it's staying at a certain heart rate for 1 extra minute. That's what I mean by overloading the muscles.
Okay, I'm sure that everyone will understand that.
Now we do. Thank you. Okay, so my last slide before I introduce it, I just want to say that we have 30 years now of exercise interventions in fibromyalgia. 6,000 people have gone through trials. So we know a lot about what works well and what doesn't work well in fibromyalgia. Withholding medications doesn't work particularly well. And exercise that's too intense does not work particularly well. What we were a little surprised about when we looked at all of these studies on a whole is that sleep was not improved as much as we thought. The thing that improved the most was physical function. So being able to get up out of a chair, walk several feet, stretch above your head, those sort of things, that improves a lot. And that's the first thing that improves in fibromyalgia. And then slowly we have some improvements in fatigue and pain and stiffness. But what really didn't improve was sleep, unfortunately. And the pain gains were very temporary. So we've started in the exercise physiology community to look at some other ways to exercise, and these are more what we would call mindful movement interventions, such as Qigong, Tai Chi, which can be done on land or in water. In water, it's called Ah Chi, and yoga with mindfulness. We have DVDs on our website of many of these, and we've modified them for fibromyalgia. As you could imagine, it would be very easy to go to a yoga class and get hurt. So it's a very specific way to modify movements, keep them near the midline of the body, and use props such as chairs and bolsters so that you don't overstretch, particularly if you're hypermobile. The nice thing about all of these mindful movement interventions is they have a lot of emphasis on what your body needs today. They have a lot of emphasis on union between mind and body, whereas aerobic type activities, you kind of put your brain out to lunch and just sort of get through the movements. But mindful movement is about being very in touch with what you're feeling and just observing those reactions, maybe not responding to them, but just being aware that they're there. And there's a big emphasis on breath work and moving in a way that utilizes inhales and exhales. So I think you're going to see a lot of yoga, Tai Chi, Qigong, for example, for fibromyalgia in fitness centers in the future. The movements are going to have less deep squatting. They're going to have more props. They're going to have less quick motions. And I think they're going to be a really great way to go, particularly if you're not getting the pain and sleep relief that you would like with our more traditional exercise programs.
Well, that's all terrific advice. And I guess one of the things that I want to re-emphasize is that you have a website where a lot of this information is. It's myalgia.com, which is myalgia.com. It's a .com, but it's not a commercial site. It's a nonprofit, and it's devoted to fibromyalgia. And you are the president of that organization?
Correct.
Okay. Madam President, we thank you very, very much for spending this time with us. We want to remind people that this fibromyalgia update is in 3 segments. We'll have slides up that will show you how to link from one to the other. We'll also have a slide up to show you how to link to the Fibromyalgia Foundation or myalgia.com. Thank you very much, Dr. Jones. It's been a wonderful experience.
Thank you.